Hello, my name is Angela Burry, and I'm a public health nurse here today to discuss the rise in adolescent female suicide rates and what can be done to combat this troubling statistic. Thank you to the Bill and Melinda Gates Foundation for giving me the opportunity to present on this critical public health issue. While suicide in adolescent females has been cited as a global public health issue by the World Health Organization, it has been predominantly shown to affect youth in North America and Europe. In the United States, there has been a steady increase in suicide rates among this gender and age over the past few decades. Since 1999, the CDC has found that there has been a 200% increase in suicide rates among adolescent females. As a result, adolescent suicide has become the second leading cause of mortality in the United States for this demographic. There are several factors which contribute to the negative impact of this public health issue. First, immaturity in psychological development and the physiological processes of puberty leave female adolescents more susceptible to depression, which can contribute to suicidal tendencies and thought processes. Additionally, in recent years, the role of social media and cyberbullying has become a significant element which contributes to anxiety, insecurity, and depression among adolescent females. Next, being uninsured or underinsured for depression treatment creates a barrier to this patient population being able to seek the help of healthcare professionals and/or obtain treatment for this condition. Lastly, in regards to pharmacological interventions that are available, the addition of a black box warning during this time period caused hesitancy among healthcare providers to prescribe treatment to adolescents at all, and it was found that a possible side effect of antidepressant use in adolescents was increased risk of suicidal tendencies. In order to better understand the adolescent female suicide rates, we can use the social ecological model to identify the complex interactions between personal and environmental factors that affect adolescent female suicide and the effect of potential prevention strategies. To begin, on the individual level, a promoting factor is the understanding that they are so young, so they have much more to live for, and moral objections to suicide, which are two beliefs that promote the public health of adolescent females. While a hindering factor is feelings and beliefs of desperation and depression, which result from the physical and psychological effects of puberty, causing adolescent females to be more prone to suicidal tendencies and ideations. On the interpersonal level, a promoting factor is frequent exposure to and interaction with peers who are able to provide social support and alert others if there is concerns that a female adolescent may harm themselves. While a hindering factor are unstable home environments, which are particularly detrimental to adolescent females who are not only psychologically impressionable, but also primarily dependent on living in the home that their guardians provide to them. On the organizational level, a promoting factor is frequent exposure to teachers who are now trained in promoting a positive school environment and identifying students who are at risk for suicide. While a hindering factor is being uninsured or underinsured, which can cause adolescent females to not be able to see a healthcare provider or get treatment that they need for depression, which can increase the risk of adolescent female suicide. On the community level, a promoting factor is community advocacy organizations which provide suicide and mental health support and intervention programs for teens to overcome access and travel barriers. While a hindering factor is media influences, which create unrealistic societal norms that cause female adolescents to feel inadequate, thus inducing depression. Portrayal of suicide as a heroic or powerful act, or as the only way to escape a bad situation, have also been found to promote suicide in adolescents. Finally, on the policy level, a promoting factor is national suicide prevention programs such as the Vibrant Emotional Health Program and the Substance Abuse and Mental Health Services Administration Organization, which provide a 24/7 national hotline that is free and confidential for anyone in distress to call and speak to a counselor. While a hindering factor is a lack of federal funding for mental health institutions and initiatives. In order to address the issue of adolescent female suicide, there are 3 evidence-based interventions which can be implemented. First is the Emergency Room Intervention for Adolescent Females, which is a program for adolescent females who are admitted to the emergency room following a suicide attempt. There are 3 specific actions that are taken in this program. First, a 2-hour training takes place with a staff member from each department who interact with the attempted suicide adolescents. Second, the female adolescent and their family watch a video which depicts the emergency room experience of 2 adolescent girls. Third, a crisis therapist facilitates a short family treatment session in the emergency room. The desired outcome of this intervention is to increase the attendance and adherence to outpatient treatment, which can then reduce future suicide attempts. The second intervention is the SOS Signs of Suicide Middle School and High School Prevention Program, which is designed for students who are in middle school or high school to increase depression and suicide awareness in education. There are 3 specific actions which are taken in this program. First, students watch an age-specific video. Second, a guided discussion takes place to discuss and answer any questions on depression and suicide. Third, a screening test for depression and suicide is administered. The desired outcome of this intervention is to increase knowledge on the topic, decrease the stigma of mental illness, and to help identify students who are at risk or currently experiencing depression or considering suicide. Subsequently, this would help to reduce adolescent female suicide through early detection and intervention. The third intervention is the Source of Strength program, which is designed for adolescents to develop peer interpersonal relationships which can help to reduce the risk of adolescent suicide. There are 3 actions outlined in this program. First, an adult advisor is selected and certified on mental health and suicide topics, resources, and counseling. Second, adolescents are certified in these same areas and designated as peer leaders. Third, the peer leaders facilitate frequent discussion and education with their assigned groups of students, either with the entire group as a whole, smaller subgroups, or one-on-one. The desired outcome of this intervention is to build a social support system among adolescents to reduce the probability that vulnerable high school students will become suicidal. Subsequently, this would help to reduce adolescent female suicide rates. Moving forward, all of these programs will be evaluated based on process, impact, and outcome measures in order to determine their success. For the emergency room intervention for adolescent females, one process measure is to evaluate the intervention on how often the female adolescent's family was able to participate in it. One impact is to see if the girls enrolled in this program regularly attend the subsequent outpatient treatment following discharge. One outcome measure is to capture if participants have a low rate of reattempted suicide. Program success would be defined as weekly participation and completion of outpatient treatment and reduced reattempted suicide rates of the adolescent females. For the SOS program, one process measure is to track how many students took part in the SOS program versus how many were actually eligible to when it was administered. One impact measure is to see if participants have a greater understanding of what depression and suicide are post-intervention versus pre-intervention. And one outcome measure is to see if the rate of female adolescents who seek help for depression or suicidal ideations from school officials increase in frequency, and to capture who was initially consulted after the SOS program is implemented. Program success would be defined as a 50% earlier detection and intervention rate for adolescent females experiencing depression or contemplating suicide. For the Sources of Strength program, one process measure is to rate how comfortable the adolescent females felt talking to their peer leaders. One impact measure is to see if participants have greater comfortability in seeking help for emotional distress after program completion. And one outcome measure is to see if the rate of adolescent females who seek help for depression or suicidal ideations increases in frequency after the program was implemented. Program success would be defined as the establishment of a healthy social support system for adolescent females. The primary potential barriers that may occur during the implementation of the interventions are a lack of funding, since all 3 of these programs require specific materials that must be bought in order for the program to be facilitated. As far as engaging stakeholders, all of the proposed interventions require external program administrators in each respective setting to be primarily responsible for collecting the quantitative process, impact, and outcome measurements. Thus, it is important that they are aware of the importance and significance of this data and understand how this data will be used. Studies have shown that when stakeholders are fully educated not only on how, but why they are collecting implementation data, it allows for them to feel an ownership in the process, which ensures more accurate and meaningful results. Lastly, ensuring that program administrators have proper training on how to proctor the programs and communication techniques would be critical. Although many of these officials are educated on communication skills as a byproduct of their profession, discussion of such intimate feelings of depression, isolation, shame, and suicide are not typically exercised. Thus, there is a need to ensure that training on how to properly support adolescent females in this sensitive topic of conversation in order for the optimal results to be produced. In order to mitigate these potential barriers, there are 2 solutions. The first is to bring awareness to all involved on the statistics around adolescent female suicide to ensure that the relevance and significance of this public health issue is understood. Secondly, education of all of the stakeholders and program administrators on adolescent female suicide would ensure an accurate identification of causes, strategies, and ultimately the potential positive impact that these interventions can have on this significant public health issue, which should help to overcome the potential barriers. Finally, this is the logic model of all three proposed evidence-based interventions. A logic model is a visual illustration which allows for you to see the inputs, activities, outputs, outcomes, and ultimate impact of the proposed programs. As you see here, all three of the proposed evidence-based interventions align with the single overarching goal of decreasing adolescent female suicide. I would like to thank all of you so much for your time and attention to my presentation here today, and please feel free to reach out to me with any questions.